So my role in the primary care team is a registered nurse care coordinator. That's my official title. I am somebody that works with patients, adult patients primarily, who are in transition. So we work with patients who are being discharged from hospital settings, skilled nursing facilities, acute rehabs. We work with them very closely after discharge, and we try to make their transition home as smooth as possible. We also try to work ahead of discharge with the care team members in the hospital and the rehab settings to make, again, their discharge home as smooth as possible. We also, as care coordinators, we have a chronic disease management program where we can enroll Medicare patients in disease management, and we follow them over time to help reduce emergency room visits, hospitalizations, and just kind of support them the best that we can. My role as the care coordinator, we work with all members of the primary care team. We work with the triage nurses, we work with the medical assistants, we work with the physicians. We're lucky enough to have social work on our team as well. And we are communicating daily with all the members of the care team to make sure that the patient is getting what they need at home, and that when they return home from a hospital or rehab setting, that their medications are correct, their appointments are correct, they have visiting nurse services if needed, and then we also work to support their social needs as well. I specifically work with more of the adult population, but we do have a pediatric nurse care coordinator who works across all of our pediatric offices to offer the same services for the pediatric population. So the pediatric nurse care coordinator can also work with a family practice patient who is younger. If I, as the family practice care coordinator, need to work with a younger person, I will also contact the pediatric care coordinator for advice and guidance. So someone who's considering joining the primary care team at CORE, I would really like them to know just how much I love my job and how much I feel supported in my role as a nurse care coordinator. I do feel like this is a very big added bonus that we get to do our jobs, because we are adding that extra level of safety and security for the patients who may otherwise get lost in such a large system. I find that the best part about my job is just working with everyone across the system, the doctors, the nurses, and really, again, advocating for the patient, because they are getting what they need, and I feel very confident in that. And I appreciate that CORE has supported this role. I feel like it's a huge asset to the company. I would just like to let anyone know who's looking for a job at CORE that we are a great group of individuals here. We are individuals that make up a team, and all of the doctors are incredibly approachable. They're incredibly kind, and they work so hard to make sure that the patients are well taken care of. And then we, as the support team, we get to do our job every day and take care of patients like we love to do.